Welcome to China Truths. In this episode, we will bring you the following story. New wave of epidemics erupts in multiple regions of China, mass death information revealed online. Now, let's dive into the details. China Truths. New wave of epidemics erupts in multiple regions of China, mass death information revealed online. Multiple infectious diseases are rapidly spreading across China, with many severe cases and deaths. As the Chinese New Year approaches, China's National Health Commission continues to cover up the true extent of the epidemic, while a viral video by a popular doctor has exposed some of the information hidden by the CCP. According to reports from state-run People's Daily, on January 17, the National Health Commission held a special press briefing on seasonal health and climate, where officials including spokesperson Mi Feng and researcher Wang Dian from the CDC Virus Prevention and Control Institute emphasized that the recent flu surge is part of the normal seasonal flu epidemic. They also claimed that in the latest week of monitoring, the positivity rate in northern regions had begun to decline, with some southern provinces also reporting a decrease. However, on January 16, China's State Council Joint Prevention and Control Mechanism unexpectedly issued a notice calling for increased epidemic prevention work in the lead-up to the 2025 Chinese New Year. The notice also called for heightened precautions at ports, travel hubs, accommodations, and restaurants, and mentioned COVID-19 specifically. In a rare move, Xinhua News Agency promptly reported this on their homepage. At the January 17 press briefing by the National Health Commission, Dr. Li Tong, a chief physician at Beijing Yuan Hospital, stated that patients with mild symptoms could quarantine at home. This home quarantine approach was commonly used during the COVID-19 pandemic in China. Previously, we reported that a number of children in mainland China died from acute necrotizing encephalopathy after contracting the flu virus, a severe complication considered to be one of the most serious consequences of the flu. The time from onset of the illness to death in these cases was often as short as a day. This news update also discussed the alarming number of children who have died from viral myocarditis caused by the flu virus. Dr. Gao Wei, a popular science influencer on Douyin, the Chinese version of TikTok in mainland China, with 29.01 million followers, created and released a video on January 8 titled Urgent Reminder, Children Are Developing Viral Myocarditis. Through 3 case studies, he warned parents that after children's fever from H1N1 or other flu strains subsides, they may develop subtle symptoms that should not be ignored. He specifically highlighted that if a child complains of pain in their calves while walking or running, it's crucial to get their heart enzymes checked, as this could be an early warning for viral myocarditis. He emphasized that this condition is extremely dangerous. The video quickly went viral, amassing millions of views in one night. It received 940,000 likes and 43,000 comments, sparking a huge online discussion and resonance among viewers. From the 43,000 comments, it was evident that the death rate from this wave of flu infections was high. After reviewing the first 500 comments, which made up 1.16% of the total, the reporter found that 20 people mentioned that family members or friends of theirs had recently died after contracting the virus, with most cases linked to myocarditis. Some notable comments include: on January 18, a parent from Shandong province commented, "My son developed explosive myocarditis. We tried for 13 days to save him, but couldn't." A netizen from Hunan province, named Second-Hand Baking Equipment, wrote on January 18, "My cousin also died from myocarditis, just 4 days ago. He was only 37, leaving behind 3 children." On January 17, a user named Wiri Sunling from Shandong province commented, "A child in our area died from H1N1-induced myocarditis. From the onset to death, it was only 1 day. The mother is a doctor." Additional comments from netizens across various provinces shared similar tragic stories. A netizen from Hainan province, named Rural Scenery, mentioned on January 18 that a colleague's 46-year-old family member died from myocarditis after contracting H1N1 flu, with the primary symptom being calf pain. A netizen from Jiangsu province, named Heart Rain, described on January 14 how a 15-year-old student died after running, the cause of which was myocarditis induced by H1N1 flu. A netizen from Guangxi Province, named Sweet Sugar Cat, revealed on January 14 that several neighbors in their area had died within a month, most of them after exhibiting fever, joint pain, and fatigue without typical cold symptoms. Many commenters thanked the doctor for his educational videos, recounting their personal experiences, and corroborating his warnings. Below are a few examples. A mother from Tianjin City, named Z Multiple Succulents, wrote on January 11, "Thank you, because of your video, I noticed that my child's breathing wasn't quite right and rushed to the hospital. His creatine kinase was 2000. We're still waiting for a bed." A mother from Anhui Province, named Pomelo, thanked Dr. Gao on January 11 for his video, which helped her realize that her child's leg pain was actually a sign of myocarditis, leading to an early hospital visit where they found his heart enzymes had spiked to over 1200. An Anhui netizen, named Huanyan, also commented on January 11, "My 4-year-old daughter had a fever, and I didn't take it seriously when she complained of leg pain. Later, it worsened after her nap. The hospital tests showed high creatine kinase levels, and we rushed her to a hospital in Suzhou." Dr. Gao posted a follow-up video on January 9, expressing his shock over the overwhelming responses. He shared a few comments, including one from a pediatric doctor whose own child had died from myocarditis after contracting the flu. This second video also gained widespread attention, with over 1 million likes and 48,000 comments. Among these, 2 additional children's deaths were mentioned. Expert opinion: the CCP is concealing the truth. This winter's respiratory infections are severe. According to China's official definition of a flu-like epidemic, an outbreak is defined when there are 10 or more cases of flu-like illness within a week in the same area or institution, verified by local disease prevention agencies, and reported through the China Influenza Surveillance System. China's CDC reported 118 cases of flu-like illness in the second week of January, predominantly of the H1N1 strain. Virus expert Lin Xiaoxu said that China's data monitoring makes it difficult to gauge the true scope of the epidemic in the country. He further explained that a significant amount of evidence can be found on social media, where people have shared stories of family members, friends, and elderly neighbors dying suddenly, many from myocarditis. These online accounts, he noted, reveal the epidemic's severity, suggesting that this winter's respiratory infections are far more severe than ordinary seasonal flu outbreaks. Dr. Lin speculated that the CCP has failed to properly inform the public about the severity of the H1N1 strain and may also be concealing cases of avian flu infections. He pointed out that the government's ban on the sale of live poultry in Shanghai for 3 years may indicate the presence of such infections. Lin also warned that repeated COVID-19 infections have led to widespread immunity decline, which could increase the risk of severe illnesses from other respiratory viruses, including myocarditis and white lung. He suspects the severity of this winter's flu may be linked to both H1N1 and possibly avian flu strains. The CCP's cover-up could lead to a larger crisis amid China's massive homecoming travels for the Chinese New Year. As the Chinese New Year approaches, with mass travels increasing the risk of viral transmission, the CCP's ongoing cover-up of the epidemic's severity could lead to an even larger outbreak. Douyin influencer Wang Wenming shared a video on January 16, revealing that the entire village next door has gone down, with elderly and children coughing non-stop, people feeling weak, dizzy, and hallucinating, with 3 days of low fever. In the comment section, a Shandong netizen posted on January 17 that, in our village, 35 elderly people have died in the last month. A netizen from Shaanxi Province commented on January 17 that, in our village, 8 people have died this year, and 2 more are on the brink of death. Other comments from people in various regions reported similar spikes in deaths, with people attributing them to flu or other respiratory infections. Dr. Lin stressed that the CCP is systematically withholding critical public health data and depriving the public of their right to information. For the CCP, the lives of ordinary citizens are not a priority, their main concern is social stability. Every time a new wave of infection hits, the government shifts the blame to different scapegoats. That's it for this episode. Thank you for watching.